Good morning and welcome to On the Porch. I'm Representative Jane Garibay from Windsor, Windsor Locks. And today I'm excited to have back with us Mike Pepe, the Director of Public Health for the town of Windsor. A lot of questions have been coming in from the public about the vaccination. What does it mean? There's different kinds and what we're going to do. So Mike has graciously last minute agreed to come on and give us some information. Welcome, Mike.
Thank you very much, Representative Garibay. I appreciate being here.
We're excited to have you, the man that knows, right?
You got it.
At least more than we do.
Well, as much as I can say, I know a little bit more probably, but I'm going to answer everything I can that I can.
Right. So the basic question is, vaccines arrived in Connecticut. I saw the numbers. It's actually been a good distribution so far, I think.
For the most part, yes. They have done a good strategy to get it out to those areas.
Right. Here in Windsor, our fire, police.
Yep. So what's going on in Windsor, all of those groups that qualify under 1A have been added for eligibility to get the vaccine if they're willing to do that.
Okay. What is 1A? That's what people are confused.
Awesome. Yep, let's start with the basics. 1A is basically those groups that are healthcare workers. They are residents in long-term care facilities, as well as, and I made sure to write it down correctly, medical first responders. So think of EMS, police, fire, if they go out and handle any kind of medical calls,
right?
It would be those people, as well as public health departments, because we're going to be the ones that are actually running the clinics. So we would qualify as well.
So that comes to the second question. People want to know, and that was very clear. Thank you. Where will they go to get? We hear that some towns are going to go through their pharmacy, others that the towns themselves are going to set up and take care of it. What is Windsor doing?
Sure thing. What Windsor doing is we have partnered with the town of South Windsor. So we actually run clinics. We run one clinic in Windsor. And we run one clinic in South Windsor during the week, okay? Now, I got to stress, these clinics are for those 1A eligible people. They know who they are. They've gotten an email from their employer to register to make an appointment. What is going to happen is as we get further down the line during this vaccination process, as more and more vaccine becomes available, there will be additional partners that will open up to be able to give more individuals, such as 1B, 1C, phase 2. They'll eventually be able to go to CVS, Walgreens, Stop and Shop, Target, any of those you would normally go to get your flu vaccine. Okay. But right now, because the supply is so short, those partners are not in the chain yet, so to speak, to be able to offer that. So right now it is just healthcare settings, i.e. think hospitals, as well as federally qualified health centers and local health departments. Those are the ones that are offering vaccinations at this point.
So where did we in Windsor give vaccinations to our 1A people?
Sure, we are giving vaccinations at the Windsor Community Center. That's where we do it, and it is by appointment only. So only those individuals that have made an appointment are eligible to come in and get in a vaccine. As we get farther down the line, there's going to be changes as to how we deliver as it gets more widespread. But for right now, it's just for those 1A members that have made an appointment with us.
Right.
Yep.
That sounds, really good. Now, is there a 1B?
Yep, very good question, because last night the state of Connecticut talked about who exactly 1B is.
It's changed a little bit.
It has changed from what I understand. And again, I'm in the same boat as just everyone else with just a smidge bit more. But 1B are those people that are 75 years or older. And that's as of right now, 75 years or older. Those individuals that live in congregate settings. Okay. And then lastly, it is frontline essential workers. So what is a frontline essential worker?
That was my next question.
That is a very good question. I'm waiting to see what the definition is that the state of Connecticut provides us. They have not told us what those groups comprise of. The first one is pretty obvious, 75 years and older, that anybody
Right,
at
that's
75 and older. But the big one is frontline essential workers. What are they talking about?
because we each have a
So
different definition of what that could be.
exactly, and that's been, one of the things that we have to remember is when we talk, we're talking throughout the entire state. What one group of people thinks of as a frontline worker may not be what another part of the state thinks of what a frontline worker is. So that's why we are really pushing for the state of Connecticut to give us an adequate definition that we can all follow.
So that people know what to expect.
Exactly.
Because I hear from, a lot of constituents and each coming from their own place. I've heard a lot from teachers. Are they considered a frontline worker? And not only the teachers, but our bus drivers. They're on the bus, for a long period of time.
Yep. And I will say each of them have a valid argument, correct?
Right.
They all have a valid argument for where they believe they should be. And that's why, we are just waiting like everyone else, because in the end, we're the ones that are going to have to be giving the shots. We're the ones that are going to have to be confirming. Jane Garibay says she's a frontline person. Let's make sure she's a frontline person.
Right.
So we're very interested in that. And we want to make sure everybody gets the vaccine that wants the vaccine.
Right.
So that's our main goal, is to get it out there.
Right. I think for me, when I was thinking of the definition, a frontline worker is someone who can't stay home from their job. Teachers are required to be, bus drivers have to drive the bus.
Right.
Anyone like that, I can stay home.
And it comes in a lot of different forms.
Right.
It's not just a cookie cutter form. There are a lot of degrees of variance on that.
Right.
So I'm assuming that when the governor and the state of Connecticut comes out with their recommendations officially with the definitions, it's going to be wider rather than narrow.
And it depends on how much vaccine we have too.
Very true. Very true. Because we can only run our clinics with as much vaccine as we get.
Right.
We're just like everyone else. We have to order our vaccine a weekend ahead. So we order our vaccine and then they tell us what they're going to give us.
Okay.
And so just because we order, just because we order X amount doesn't mean we're going to get X amount.
Right. And I think everyone's doing a good job. I would not want to be in the governor's shoes.
Oh, no.
I wouldn't want to be in your shoes. Seriously. I mean, everyone is working as hard as they can, trying to help people, save people, keep our state safe. So it's very easy from, my home to judge, well, maybe it shouldn't be a 1B. Maybe that should be a 2C.
Right.
So I just want to say it's very difficult decisions being made. And thank you for clarifying. It does depend on how much we get.
Right.
So we have 1A, 1B. Then what does it go to?
And then it goes to 1C.
1C?
Yeah, and 1C, I cannot even begin to tell you what that would be comprised of. What I will say is the Governor's Advisory Council on COVID vaccinations, they're meeting on January 14th. And that is when they are going to firm up the 1B with definitions and also give some preliminary guidance on 1C. So that's something to look forward to next week. I'm hoping that there'll be an announcement, a better announcement coming out. And before we get any further, before I forget, I just want everybody to know that without the help of volunteers and everyone else in the community that is helping with these clinics that we do in Windsor and South Windsor, they would not be possible. That includes the staff members of the health department. That includes all of the volunteers. Without everybody working together, we would not be able to do this. And everybody that is volunteering, working, helping out in their own way provides a giant benefit to everybody for the town of Windsor. So I just want to give a big shout out to all those people.
Absolutely. I know just from having had the COVID and how Jen followed up and everything she had to do, and that's above your normal work. It's adding. So the Windsor South Windsor, that's part of the MDA?
Yes, that is part of MDA 31.
Years ago. And now it comes to...
Now it's finally getting used for what they designed it for. There have been minor instances where we've used it for H1N1 back in the day, but this is the first think of it as a full-scale, foot pedal to the metal. This is how it's going to work, and it's worked very well. It's
So
been a
people
very
have to
good
know
partnership.
that, because I
Yes.
was on it when it was first started with Charles Petrillo.
Yep.
And there were a lot of people, why are we doing this? You know,
Right.
but now,
Yep. Now, all of those years of having the rosters and keeping people engaged, it's paying off now.
right.
Yes.
So did I see that our numbers went up again in the state? Are our numbers still continuing to go up with the virus?
Yes, it's still on an upward trajectory.
But it's less hospitalizations if I'm watching the numbers correctly.
Yes.
So we're treating people, well, we're learning about
Right.
the virus and being
Yes.
able to treat it better.
Yes.
So that's a good news.
Yes. You know, and again, the more people we get vaccinated, you know, the better. It's going to take time. Just like anything else, this virus is also seasonal, it appears. You know, we had the really high stuff in the end of the winter, early spring.
Yeah,
It came really strong, and then it kind of abated during the summer.
right.
Now winter came, it's coming back, so we're waiting to see how it's going to flow that trajectory as well.
Well, I'll be there as soon as my number comes in, whatever I am, I will be there for the I'm seriously, I would be
Yep.
terrified to get it again.
Oh, yes.
And I wasn't hospitalized long-term or anything. So, you know,
Yep.
I will be
And-
there.
Yeah, and let me just say, when we do vaccinations, and I'm talking about appointments, people might not understand what I'm talking about. Because of there's such a limited quantity of the vaccine available, we actually have to make appointments through a software program that is a restricted program. So those people that are identified as being eligible for a vaccine, they
Okay.
get an email from work, and through that, they are able to make an appointment anywhere in the state of Connecticut that is able to give a vaccination. They do not have to come to Windsor if they live in Windsor. They can go to Bristol, Burlington, they can go to Bridgeport, they can go to Fairfield, they can go to Hartford, wherever an appointment is available, and they can make it, they can get to it. So,
What if you don't work? How do you get?
well, that's the thing. For right now, it's only those for 1A. That's how it's working.
Okay.
So when 1B comes into effect,
They'll
with
be
those
able-
individuals that are 75 and older, how are they going to do this? You know, there are technological challenges. You know, there are,
I know.
yeah, you know, there are many challenges that need to be overcome. So right now, the state is working on a plan to get access for those people that are 75 and older. I am not privy to it.
Okay.
The health directors, we haven't been told how they're still working on it.
So
Well,
the state will notify the seniors.
Well, we don't know that. The state is going to provide information on a publicity campaign,
Mhm.
i.e., this is how you're going to be eligible. So we're waiting to find out how they feel this process is going to work.
Okay.
And then once we find out, we're going to post it on the town's website,
Okay.
Town of Windsor's website, so that anybody can go on and see, how do I get a shot if I'm 75 or older?
And
So-
they can sign up for the town manager's report on the website, which
Yep.
is good too. I think that's weekly, right?
Yes, that is.
And it'll have the information out, so you would get an email.
Yep.
Town
Yep, so-
website.
Yeah, it's we're waiting just like everyone else to see how all of these moving parts are actually going to fit together.
Right.
And because we really do need to vaccinate those that are, you know, older. We need to get it to those susceptible populations, not only age, but other susceptible populations throughout the state. And
Well, And it'll open life again for
Yep.
those people that have been quarantined for 9 months now, or what is it, 10 months
Yes.
now? They'll be able to start living. I think of travel, you know, once the world gets it together,
mhm.
and hopefully we don't have another thing like this in my lifetime, I could hope. But,
I'm
you know,
hopeful too.
get some normalcy back to the world. Just before we sign off, that's all been very clear and I really
Yep.
appreciate it. And I know how many meetings you go to on this and that it's ever changing and you're doing
Yep.
your best to give out the information to the public. What are the guidelines, CDC guidelines right now? We're still supposed to wear our masks.
Yep. Yeah, you're still supposed to wear a mask. You're still supposed to social distance. That's very important. And also try to stay within your household family group. We want to limit those cross interactions where you may pick up something from going to a friend's house or to a relative's house, even though they might not be showing any signs or symptoms. We've learned that, there are quite a few people that are asymptomatic that transmit.
Right.
So it's just really just to keep doing what we've been doing, washing our hands, wear that mask, adhere to everything you've been doing throughout the last 9 months, because it is working. It is working. And that is one of the things that we've been trying to preach is you may not see the results right away, but it is working, because we can only imagine how bad it would be if we weren't doing this.
Right. It could be much worse. Absolutely.
Exactly.
But I think all of us are starting to know people that have actually had it.
Yes.
At the beginning, there were very few and you didn't hear
Right.
about it, whatever.
Yep.
Now you'll be calling someone and there's, oh, I'm in quarantine, or,
Yep.
And people don't understand too, that if let's say it's your husband is sick,
Mm-hmm.
and he tests positive, you have to go and get tested, but you also have to quarantine for 14 days. Am I correct?
Yes, that's true. But actually, it gets a little bit different. It's a little bit more than 14 days.
Okay.
So if you live with your husband gets test positive, right?
Mhm.
So he is isolated for 10 days. Now, if you think about it, you're living with this person, you're interacting with him. We're asking you to stay home while he's sick, correct? But you also have to quarantine after he's sick.
Right. I remember now.
Yep. So you're actually home for almost 24 days.
Right.
And now with the new guidelines from the governor and the state health department, where you can test out after 7 days.
Okay. So that
quarantine.
after 7 days.
So what happens is, if you're quarantined, the state has changed it where it's only 10 days now. You only have to do 10 days. It's no longer 14. But if you get a test, a COVID test, and it is a antigen test, which are really fast, or the normal longer PCR test, if you test negative and you get that test on day 5, if you test negative, you are allowed to stop your quarantine after day 7. So that means on day 8, 9, and 10, you don't have to be quarantined.
Okay.
As
But
long as you tested negative. Yep.
Very complicated.
Oh, it definitely is. And that's one of the things that we try to do. We go over this with, family members and
Right.
other individuals.
Is this
so, yeah,
up on the website?
Yes, it is. I believe it is. I will check.
I think so.
Yep, I believe it is.
So, because again, as it's ever changing, it's good to
Yes.
keep,
Yep.
on that. So another last question, because people have asked me, there's different vaccines.
Mm-hmm.
Do they work the same way? Are they different? Is there one better than the other?
Yep.
I think there's 3 out now, right?
I believe there's 2 that are being used, and then you have the one that's available in Europe,
Okay.
the AstraZeneca one that has not been approved yet in the U.S. So while there are 3, in the U.S., we're using 2, Pfizer and Moderna.
Okay.
I will tell you now that all of the local health departments that are running clinics throughout the state, as well as the federally qualified health centers,
Mhm.
they are all using Moderna. Okay. And that is because of storage capacities. Pfizer has a very difficult set of storage requirements that mainly only healthcare centers can meet. Okay. So on the average, healthcare centers are using the Pfizer vaccine. Think of Harvard Hospital, St. Francis, those kind of, Yale, New Haven. They would be giving out the Pfizer in addition to Moderna.
But if you start with one, you got to finish with that one. You can't.
That is correct. You cannot go between both. So if you start with Moderna, your second dose after 28 days has to be Moderna as well. And regarding what the differences are between them, you could call it Coke versus Pepsi.
Okay.
They're made differently. They both have roughly a 94, 95%.
Which is huge, isn't
Which
it?
is, I'll take a 94 or 95, on anything, I'll take that. So that's a
better than the
very
regular
good
flu.
protective factor. So
Yeah.
they're both within that range. It's really just about what is available at the time of your vaccination. Yep.
And whichever one it is, get it.
Yeah, whatever one it is, if that's something you really want to do, I urge everybody, when the opportunity arises, be sure to vaccinate, because it will definitely provide a benefit, not just for you, but for everyone else in your social circle and your family.
Too. And yeah, because you just don't know how the virus is going to hit you.
Yeah.
They talk about older people,
Mhm.
if you're diabetic, different things. But I've seen perfectly healthy
Oh, yes.
30-year-olds, die from it.
Yes.
So you just don't know. It's like playing Russian roulette with your life. If that's just my personal.
Well, it is a very serious disease, and just because we don't see it doesn't lessen its seriousness. This is something, as you mentioned earlier, we're seeing it more now because we know people that have had it. It's becoming more serious to us now because we know of people, our friends, our family, our relatives. We hear it's just along the same lines of knowing people that have cancer or who have beaten cancer. Okay, I may not have had cancer, but I know it's really serious. Okay,
And
because I know people that have had it.
I know.
So it's the same thing with this COVID-19. It's getting more and more people are getting it. There's now more of a connection with individuals.
Yeah. So again, I have one last question.
No, that's no problem.
They're talking about a new strain and that there were 2 cases in Connecticut.
Mhm.
It's the same virus. It's just changed where it's working faster or affecting faster, or
Yeah, there's a new strain that has appeared from Europe. Connecticut, I believe, was the 6th or 7th state that has reported.
lucky us.
Exactly. Basically, like anything else, things change over time. A virus is constantly evolving, trying to change to survive, just like we do. We constantly change. So this virus is out there and is changing little by little, to try to keep going. So this is just another example of that. And as it changes, there are some things that it does better, which is more of a detriment to us, which is worse.
Right.
It's more lethal, or it may spread faster, or you may have it longer.
But it is effective. The vaccines are effective with the change, right?
That's what we've been told. That's what we have been told. So we're glad for that. But again, we're going to see this happen. The COVID is going to be changing.
Right. And I don't mean to put you on the spot, but I will a little bit.
No problem.
So you're on the ground there. You're
Yep.
seeing this. You're meeting people that have had the virus. So to people that say this is just like the regular flu or it's just like a cold, what can you share with us from what you have actually seen?
I will say that it depends on the. Yep. No. What I can tell you is this virus acts differently on every single person. This is not a cookie cutter. Everybody's going to feel A, B, C, or D, or E. Okay.
Yeah.
I am aware of people that have been bedridden for 8 days that have had it. And I've seen people that have had it where they never knew they had it. The only reason they found out they had it is they just went and got tested because the line was shorter at the drive-through testing site.
Right.
And they decided, why not? Let's go do it. I will say this, is that it is very important that everybody needs to try to minimize their contact with individuals if you are positive. Okay? Anything we can do to slow down the spread, we are all on the same team. We need to remember that. This is a virus that does not know any bounds. It will infect anyone and everyone. And the range of symptoms are from A to Z. And I'm sure there's probably some symptoms we're not even aware of yet.
Right.
So there's been mild cases, there have been very bad cases. It just affects everyone in very different ways, and it needs to be taken seriously.
Right. And even with the regular flu, I'm like, stay home. Don't come into the office if you've got, flu-like symptoms. With a regular flu.
Yes.
This is even.
Yep. And I'm glad you brought up the flu thing. one of the benefits of what we've been doing with the mask wearing, the hand washing,
It's kept
our
the
flu rates are down 80%,
Yes.
90% flu rates are down because everybody is staying home if they're sick. Everybody's wearing a mask. We're washing our hands. We're not hugging. We're not doing those personal contacts. So there is a small glimmer of
We noticed
effect
that.
of what we're doing.
Yeah, we were talking about that. We're like, well, we haven't seen the regular flu out there. Normally by this time, by Christmas,
Yes.
you have a lot of cases, and it has been a lot less, but we're learning, hopefully.
Yes. Yep. So there has been a positive benefit in addition to helping save people from contracting COVID. Our flu numbers are dramatically down this year.
Because we feared getting both at the same time.
Exactly.
People getting them.
Yep. And we still urge people to get the flu shot. If you need to get a flu shot, get the flu shot.
Yeah. I got mine back at, I think, October, beginning of October. How long do they last, the regular flu shots?
They generally last through the cycle. So usually October through June, July, August, somewhere around there.
So we're good. Well, I want to thank you. I know it was last minute. I just called you yesterday, and you're so accommodating.
Yeah.
We really appreciate it. And hopefully, people can watch this, and if they have any questions, and if things change a lot, I'll ask you to come back on. It's a great way. And again, I really appreciate and all the staff work in town hall. And I agree, the volunteers being on the MDA, I know what everybody did.
Yep.
So it's great. And thank you so much, Mike. I feel better today after hearing everything.
That's good. Good. And I appreciate you giving me the opportunity to talk. Whenever you want me to come on, I'll come on. I love to talk about this stuff. I want to get the information out there. Let's get it out there the first time, the right way. And anytime, any place, I'll do it.
Thank you so much. Well, thank you everyone for joining us on the porch. We just had a great interview with Mike Pepe, the Director of Public Health for Windsor, and we look forward to seeing you next week with another On the Porch. Have a great weekend.